Huntington's disease is a progressive, genetic disorder that causes the degeneration of nerve cells in the brain. It leads to the gradual decline of motor control, cognitive function, and psychiatric health. Here's a detailed overview. Huntington's disease is an autosomal dominant disorder, meaning the person only needs one copy of the mutated gene from either parent to develop the disease. The gene responsible for HD is the HTT gene, which provides instructions for producing the Huntington protein. The mutation in this gene causes the production of an abnormal version of the protein, leading to the gradual breakdown of brain cells. Symptoms of Huntington's disease usually develop between the ages of 30 and 50, but they can appear earlier or later. They typically progress over 10 to 20 years. Symptoms are categorized into three main groups. Motor symptoms: chorea, involuntary, jerky movements that may affect the face, limbs, and trunk. Dystonia, sustained muscle contractions and abnormal postures. Bradykinesia, slowness of movement. Difficulty with coordination, problems with balance and fine motor skills. Problems with speech and swallowing, difficulty articulating words and swallowing. Cognitive symptoms: memory problems, difficulty recalling recent events or learning new information. Executive dysfunction, impairment in planning, organizing, and executing tasks. Difficulty with problem solving, challenges in managing complex tasks and decisions. Psychiatric symptoms: depression, feelings of sadness, hopelessness, and a loss of interest in activities. Anxiety, persistent worry and nervousness. Irritability, mood swings and aggressive behavior. Psychosis, in severe cases, delusions or hallucinations. Diagnosis of Huntington's disease involves a combination of clinical evaluation and genetic testing. Clinical evaluation: medical history, family history of HD and a detailed assessment of symptoms. Neurological examination, evaluation of motor symptoms, coordination, and cognitive function. Genetic testing: HTT gene test confirms the presence of the mutation associated with HD. This test can be done if there is a clinical suspicion or if family history suggests the possibility of the disease. Neuroimaging: MRI or CT scan, used to identify atrophy in specific brain regions, such as the caudate nucleus and putamen, though these are not definitive for diagnosis. Treatment: there is currently no cure for Huntington's disease, but treatment focuses on managing symptoms and improving quality of life. Medications: antipsychotics, used to manage chorea and psychiatric symptoms. Antidepressants, help with mood disorders like depression and anxiety. Tetrabenazine, specifically approved for managing chorea. Therapies: physical therapy, aims to improve motor function and coordination. Occupational therapy, helps with daily living activities and maintaining independence. Speech therapy, addresses speech and swallowing difficulties. Supportive care: counseling and support groups, provide emotional support for patients and families. Care planning, ensures a coordinated approach to managing symptoms and planning for future needs. Genetic counseling, offers guidance for individuals and families regarding the risks of HD and options for family planning. Prognosis: the progression of Huntington's disease varies among individuals but generally leads to increasing disability over time. Life expectancy typically ranges from 15 to 20 years after the onset of symptoms, though some individuals may live longer. The progression and severity of symptoms can affect quality of life and may require comprehensive care. Research and future directions: ongoing research aims to better understand Huntington's disease, develop new treatments, and eventually find a cure. Key areas of research include gene therapy, investigating ways to correct or modify the defective HTT gene. Neuroprotective agents, developing drugs that may slow or halt the progression of neurodegeneration. Clinical trials, exploring new medications and therapeutic approaches. Conclusion: Huntington's disease is a challenging condition with significant impacts on motor, cognitive, and psychiatric functions. Early diagnosis, comprehensive symptom management, and supportive care can help improve quality of life and support individuals and families dealing with the disease. Ongoing research offers hope for future advancements in treatment and potential cures.